Hello and welcome to our partnership podcast on our series A Day in the Life Of. As you may know, our series A Day in the Life Of tells the stories of some of our amazing partnership colleagues and what they do in their everyday roles to help make a more caring, safer and healthier Edinburgh. Up until now, we've had a number of blogs and podcasts where we've been joined by our colleagues, which have been shared in our colleague newsletters and our new Sharing Our Strategy homepage on the Edinburgh Health and Social Care Partnership website. But today I'm joined by Jess Gilmour, a student specialist practitioner district nurse. Now, some of you may remember her very personal blog that was shared last week about her experience as a student district nurse, and it's no surprise to me that we had a lot of great feedback and people wanting to know more. So Jess, thank you for joining me today. How are you?
I'm fine, thank you. How are you?
Yeah, I'm good, thank you. I'm glad you're able to join me here today.
Thanks for asking me to do this.
Of course, no problem. So let's just jump right into it here. As I say, I really enjoyed your blog, and I'm sure others will agree. It was written so personally, and I think a lot of people resonate with that. Can you tell me a bit about your role as a district nurse, just for those who don't really know what that means?
Yeah, so district nursing teams support people who are housebound, and we deliver skilled nursing interventions in people's own homes. This involves working closely together with the people on our caseloads, their families and carers, and a huge part of our role is about coordinating all the different services that might be involved and really acting as an advocate for people. There's a number of government initiatives which are looking at upskilling district nursing teams, with the focus being on preventing unnecessary hospital admissions and promoting people's independence so that we can support them to live in their own homes for longer. District nursing teams are a team of community staff nurses led by a district nurse. So the district nursing qualification is recognised by the NNC, and I'm just in the process of completing my specialist practitioner qualification to become a district nurse.
That's great, and I can tell just by reading your blog and speaking with you today that nursing is something that comes naturally to you. You said in your blog that district nursing is close to your heart. Is it fair to say that you always wanted to be a nurse because of this? And can you remember the moment when you decided you were going to make that step to becoming a nurse?
So I never expected that I would go down the nursing route, and I think it definitely came as a surprise to my family as well. My dad is now a retired GP, and I think he always hoped that me or my brother would end up going down a similar route, but he probably expected that it would be my brother instead of me. So when I first left school, I studied psychology. I think I've always had an interest in people and their behaviour and what makes people tick. And during the course of my psychology degree, I started to think, maybe I could go into nursing later on. So I started trying out different opportunities. I spent my summers working in a coffee shop in a hospice, and I really enjoyed getting to know people and supporting them and what they were going through there. And I travelled to Tanzania in one summer and volunteered in the hospitals out there, and it was a really eye-opening and harrowing experience. So I thought, if I can do that, I could probably do a degree in nursing after all. But I still have the occasional incident where I will faint if anything's too gory.
Oh, I know. I think that would be the part that would get me the most. I think I'm a bit too squeamish, but that's so interesting that you went to Tanzania as well. How long were you there for?
I was there for 4 weeks. I volunteered in a paediatric ward, looking after children with malnutrition, and in a general medical ward and a surgical ward as well. The surgical ward I can barely remember because I just fainted constantly.
Oh.
It was an amputation. I remember watching that getting done, and out in Tanzania, anaesthetics I think are too expensive, so the poor guy was just about awake while they were sawing his leg off. It was really horrific.
Oh dear, that sounds so horrific. Yeah, we don't know how lucky we are to have the NHS throughout the UK, do we?
Oh, absolutely. We take so much for granted, just like hand washing between different patients, and there's so many infectious diseases out there as well. Yeah, we don't know how good we've got it here. I think Tanzania was hit really badly by the COVID pandemic as well. So although we think we've had it bad here, it has been so much worse elsewhere.
Yeah, I know, definitely. We really are so lucky. And, you know, there's so many, like, this is why we're sort of doing these sort of podcasts and blogs. There's so many great colleagues that we have out there that are doing everything that they can to help support and look after people, and it's just nice to highlight that every now and then. It's nice to share some nice stories. So thanks for sharing that. And I know also from your blog that, you know, it's not been a plain sailing experience for you to becoming a nurse. There's always going to be some challenges and hiccups along the way, but can you tell me how you felt when your first application was unsuccessful, and what did you do to make sure that you would succeed the next time round?
Yeah, so I initially applied for the district nursing course, and I think I'd only been qualified about 18 months, but I was completing a module in clinical decision making, and I felt like the district nursing course was really the next step for me. But I think I was definitely unprepared for the intensity of the interview. And you're required to do a presentation about leadership and answer a lot of questions focused on leadership. So I think I lacked a lot of confidence in my own leadership ability, and I was definitely quite disorganised and flustered in the interview. So although I was disappointed that I was unsuccessful, I understood why. But I asked for some specific feedback from the clinical nurse manager who'd interviewed me, and she gave me a lot of encouragement to focus on developing my leadership abilities and to reapply at a later date. I got a lot of support from my team and my district nurse at the time as well, and I was really encouraged to step up and take a leading role in the team and in coordinating people's care. And my district nurse gave me a lot of leadership opportunities, like orientating new members of staff and supporting students. And so I had more confidence the next time that I applied.
Yeah, oh, that's so good that you had that sort of support around you.
It's so important to have a good network of colleagues around you to support you.
Yeah, definitely. And I'm glad that you were able to get that and, you know, achieve the next step of becoming a district nurse, which is so nice to hear. Going back onto like touching on COVID, like we did earlier, this has obviously been one of the most challenging year and a half in health and social care. How would you say the COVID pandemic has impacted you and your role as a nurse?
I think within district nursing, the COVID pandemic really highlighted what an adaptable and resilient service we are. While a lot of healthcare professionals were working from home and minimising face-to-face contact with people, this wasn't really an option for us. And the demand for people needing district nursing input actually increased a lot. And there was a lot of focus on community nurses using clinical decision-making skills and making assessments of acutely ill and deteriorating people, and the number of people requiring palliative and end-of-life care in their own homes increased a lot as well. And I know that many teams were involved with supporting care homes, which had sadly suffered COVID outbreaks.
Yeah, it's been so hard, hasn't it? The past year and a half, it's been completely unprecedented. But as you say, you know, we have shown our resilience and just worked really hard to keep everyone as safe as possible.
Definitely, I think in my blog post I mentioned that it felt like it's really held us back, and it's been such a hindrance. Lots of learning opportunities have been put on hold, but COVID itself, it's been a huge learning experience for people, and I think moving forward, we know how to work under extreme pressure and in really stressful situations, and it will take us a long way in our future careers as well.
Yeah, definitely. But with all of those challenges come great reward. what would you say is the most rewarding part of your role?
Definitely, I think the most rewarding part of working within district nursing is the unique contribution that I think we make to people's lives and the strong relationships that we build with the people on our caseloads and their families and carers. It's really rewarding, especially when we've supported people at the end of their lives and they've had palliative care needs at home. You just grow so close to people.
Oh, that's so nice. Yeah, it's definitely great to have a good network around you in your career.
Oh, definitely. And I think having this, you grow so close to your colleagues as well that you just become like a big dysfunctional family that you could just pick up the phone to for support whenever you need it. Just have a shoulder to cry on. It's quite hard to explain to people exactly what our jobs involve, so you just become so close to your colleagues because they're the only people that really understand what it's like.
I know, that's so true.
Definitely.
And one final question I always like to end on. I know you're so early on in your career and you have so many more successful years ahead of you, but if you were to think back to your first day in your role as a student district nurse, what would you tell yourself looking back after what you've learned so far?
I think on my first day as a student district nurse, I probably felt like a bit of an imposter. But with the amazing support that I've had from my network of colleagues around me and my amazing practice assessor, I've been able to grow and flourish into a leader in my own way. And I think that my message would be not to underestimate yourself. I think student nurses, newly qualified nurses, everyone has so much to contribute to a new team and a new role. And I think enthusiasm and having a willingness to learn and develop goes a long way.
That's so lovely. What a nice note to end on. It's been so lovely speaking with you today, and thank you so much for sharing your story. It's been really inspiring to hear firsthand from you, and I'm sure a lot of people can resonate with this podcast too. And of course, thank you for everything that you've done to help keep the people of Edinburgh safe and well. It's been so nice speaking with you today.
Thank you for having me.
Thank you.